We are the East Cheshire NHS Podiatry team. In the following video, I'm going to show you how to care for your feet. We all spend a lot of time on them, so here are some tips and advice on how to keep your feet healthy. It is important to check your feet daily, especially those with rheumatoid arthritis or diabetes, as this can cause numbness. The best time to do this is in the morning before you get dressed or in the evening before you go to bed. This is also a good time to apply foot cream or emollient. This can be applied all over the foot, avoiding in between the toes. As part of your regular foot care, you need to keep your toenails tidy to reduce the risk of ingrowing toenails and discomfort. If you can't reach your feet, please ask a carer, friend or relative to help. If you do wish to cut your nails, you'll need the following equipment: nail nippers, a file or emery board and wet wipes. Please do not use scissors. It is important you clean the equipment before and after use with a disinfectant, and do not share your equipment. Filing your nails weekly will help keep them short and will reduce the thickness, which will also help with cutting. Start at one side of the nail and cut straight across. Don't cut them too short or down the sides. We suggest leaving a visible line of white, then file as before. Afterwards, check between your toes for debris and clean with a wet wipe. If you damage your toe whilst filing or cutting and it bleeds, please apply pressure. If you are on any anticoagulants or blood thinners such as aspirin or warfarin, then you may need to apply pressure for longer. Elevate the foot to hip height until the bleeding has stopped, then apply a sterile dressing. It is important that you put on clean socks or hosiery daily, and it is recommended that you always wear slippers or shoes when you are up and about. Please check the inside of these for any objects which may cause your feet harm. Check between your toes for any soggy areas or athlete's foot which have become red or itchy, and look for any changes that are not normal for you. Athlete's foot can be treated with an antifungal spray or cream. Surgical spirit can also be applied to soggy areas, but please do not apply to broken skin. These products can be found at your pharmacy. If you have any worries or concerns, please contact your podiatrist or GP. It is important you wear the correct footwear to prevent damage to your feet. The toe box should be deep and wide, the heels low, with a cushioned sole to protect your feet. The ideal shoe has laces, buckles or Velcro straps which will hold your feet securely. This will stop your feet sliding around, preventing any pressure or friction. If you can't reach your feet, use a mirror or ask a friend, carer or relative to help. You should check all areas, including around the heel and in between the toes. If you have any questions or concerns about what we have just covered, please contact your local podiatry team or GP. Thank you for listening.